Welcome to the SBIRT training video. SBIRT is screening, brief intervention, and referral to treatment.
This training is designed to promote your knowledge and understanding related to the following learning objectives. By the end of this training, you should be able to identify the key components of SBIRT, understand and describe the necessary steps involved in proper screening, brief intervention, and the referral to treatment process. Understand how SBIRT services are integrated into the clinic setting. Understand how SBIRT can be incorporated into clinical sessions in a quick, with little time required manner. Understand and explain why it is important to identify and address alcohol or drug use during the clinical session.
The screening, brief intervention, referral to treatment, or SBIRT model is widely recommended as part of routine well visits in pediatric primary care. It is an evidence-based practice to prevent and reduce substance use among adolescents ages 12 to 18. The American Academy of Pediatrics encourages primary care clinicians to follow the SBIRT model and recommends universal screening for substance use with adolescents.
Increasing screening opportunities whenever a teen receives any medical care can increase the chances of identifying risky substance use. Because the adolescent age group is at the highest risk of experiencing substance use-related health consequences, it is also the most likely to derive the most benefit from universal SBIRT.
The screening portion of SBIRT uses standardized tools to quickly assess risk level. The pre-screen is universal and the full screen is targeted based off the responses of the pre-screen. Brief intervention helps patients understand their substance use and health impact. It motivates behavior change. Referral to treatment helps patients showing signs of a substance use disorder to access specialty care.
SBIRT is an evidence-based model based on 6 elements. It's quick and efficient. The average screening time has a duration of only 5 to 10 minutes. It's universal. It is recognized as a standard intake process. It's comprehensive. It's a seamless transition between the initial brief screening and/or treatment and referral to a higher level of care. It's accessible. It is utilized in public settings to reach larger audiences. It targets behaviors. It's associated with preconditional substance use such as binge drinking. And there's strong evidence that supports the SBIRT model. When SAMHSA, which is the U.S. Substance Abuse and Mental Health Services Administration, conducted a 5-year study on SBIRT, there were over 1 million individuals screened. Heavy drinking declined 72%, and illicit drug use declined by 80%. Even after the grants expired, 88% of the agencies continued to utilize SBIRT.
SBIRT is a structured conversation to promote prevention and to identify early risk factors for substance use in middle and high school students. A universal health screening. This should be just as routine as checking height, weight, sight, and hearing. And proactive. It's identifying risky behavior before there is a major problem. SBIRT is not a targeted screening. All patients are screened. SBIRT is not drug testing, a treatment program, or to get any patients in trouble.
According to whysbirt.org, all youth experience social determinants of health, or conditions in which they are born, grow, and live. These conditions create a set of protective factors that decrease the likelihood and risk factors that increase the likelihood for engaging in risky substance use. Each youth has a unique set of protective and/or risk factors.
These personal circumstances are like a pot of water on a stove, where each risk factor turns up the heat, making it more likely for the pot to boil over and for the youth to engage in risky substance use. Some examples of risk factors include economic instability, limited access to health care, and having a parent with a substance use disorder. When adolescents experiment with alcohol and other drugs, it can heat up and boil over into a bigger problem. By creating environments that keep the heat down for adolescents, we can prevent substance use from boiling over into a bigger problem.
Adolescence represents both a critical at-risk period for substance use initiation, as well as an opportune time to intervene and prevent behaviors from developing into more acute health problems. Not all adolescents who experiment with drugs and alcohol will develop a substance use disorder. However, all psychoactive substances have negative effects on the still developing adolescent brain. Healthcare professionals have a responsibility to do their part to turn the heat down on adolescent substance use by educating youth, identifying risky use, and intervening early. Systematic screening can lead to beneficial health outcomes and reduce future misuse. Substance use by youth has an enormous impact on their health and well-being. Substance use in youth is associated with academic and social problems, risky sexual behaviors, memory loss, accidents, and injury and suicide. Substance-using youth compared with non-users are at an increased risk for academic failure, including dropout, especially when the use is frequent and heavy. The developing brain is particularly susceptible to long-lasting changes in cognition from substance use. Impaired judgment and coordination resulting from substance use can lead to vehicular accidents and other injuries such as falling downstairs. Youth substance use puts young people at risk for HIV, STDs, and pregnancy. Teens with substance use problems are particularly susceptible to suicide and suicide attempts. 75% of suicides involve one or more substances. 69% of suicides involve alcohol intoxication.
Screening quickly assesses the severity of substance use and identifies the next steps, including the appropriate level of treatment. Screening can be written or oral and can be self-administered or given by a staff member or a clinician. In looking at the pyramid, once screened, the majority of students will fall into the no or low risk category and require no intervention. The risky use category is where the brief intervention would occur. The top of this pyramid, SUD or substance use disorder, is where the referral to treatment is necessary.
Some commonly used tools for implementation of SBIRT for substance use are CRAFT, Car, Relax, Alone, Forget, Friends, and Trouble. S2BI, Screening to Brief Intervention. BSTAD, Brief Screener for Tobacco, Alcohol, and Other Drugs. GAIN-SS, Global Appraisal of Individual Needs, Short Screener. And the NIAAA, National Institute on Alcohol Abuse and Alcoholism. Regardless of the tool used, asking about alcohol or other drug use may be especially difficult with adolescents who may not want to admit or discuss substance use. Successful screening can be enhanced by knowing the tools and practicing the conversation skills required to put an adolescent at ease. Confidentiality in this process is extremely important. Research has shown that adolescents who are aware of confidentiality are more willing to share information compared to their peers who may not have the same confidentiality. Adolescents may feel more comfortable and provide more accurate responses using a self-administered brief screening due to the sensitive nature of the topic. Self-administered computer screening is valid and time-efficient for adolescents, and some adolescents may actually prefer this method.
Let's take a more detailed look at some of the screening tools. The CRAFT tool is a well-validated substance use screening tool for adolescents aged 12 to 21. It is recommended by the American Academy of Pediatrics Bright Futures Guidelines for Preventive Care Screenings and Well Visits. There are multiple versions of the tool, and it can screen for alcohol, drugs, marijuana, and the latest version added vaping and nicotine. The tool is available as a self-administered questionnaire to be completed by a patient and as an interview tool to be administered by a provider. The CRAFT is available in several languages. The CRAFT tool is free to use, and it is the most popular of the tools to use. If you take out your phone and scan the QR code, you can access the online tool in either English or Spanish.
Let's look at the CRAFT initial screening tool in more detail. In Part A, there are 4 questions that are open-ended. During the past 12 months, on how many days did you drink any alcohol, use any marijuana, use anything else to get high, or use a vaping device containing nicotine or any tobacco products? If all 4 answers are no or a score of 0, then ask the CAR question only. A score of 1 or more, then you ask all 6 CRAFT questions. The C, have you ever ridden in a car driven by someone, including yourself, who was high or had been using drugs? The R, Do you ever use alcohol or drugs to relax, feel better about yourself, or fit in? A. Do you ever use alcohol or drugs while you're by yourself or alone? F. Do you ever forget things you did while using alcohol and drugs? F. Do your family or friends ever tell you that you should cut down on your drinking or drug use? And T. Have you ever gotten into trouble while you were using alcohol or drugs?
NIDA has launched 2 brief online screening tools, the S2BI, Screening to Brief Intervention, and the BSTAD, Brief Screener for Tobacco, Alcohol, and Other Drugs, that providers can use to assess for substance use disorder risk among adolescents 12 to 17 years old. The BSTAD and the S2BI ask patients about frequency of past year use and triage them into one of 3 levels of substance use disorder: no reported use, lower risk, and higher risk. BSTAD and S2BI can be administered in less than 2 minutes. Both screening tools were validated in adolescent samples, demonstrating accuracy in identifying adolescents with and without substance use disorders who were seen in pediatric primary care settings. BSTAD and S2BI can be self-administered or provider-administered using a tablet or computer. Providers are encouraged to consider patient self-administration to save time. In addition to the risk score, clinicians receive information about the score's implications, suggested actions, and additional resources that were compiled through subject matter expert consensus. Scan the QR code to access the S2BI online tool. Scan the QR code to access the BTSAD online tool.
The NIAAA, National Institute on Addiction and Alcoholism screening tool, introduces a simple, quick tool for identifying youth at risk for alcohol-related problems. This screening tool has many benefits. It can detect risk early. In contrast to other screens that focus on established alcohol problems, this early detection tool aims to help you prevent alcohol-related problems in your patients before they start or address them at an early stage. It's empirically based. The screening questions and risk scale developed through primary survey research are powerful predictors of current and future negative consequences of alcohol use. It's fast and versatile. The screen consists of just 2 questions, which can be incorporated easily into patient interviews or pre-visit screening tools across the care spectrum, from annual exams to urgent care. It's the first tool to include friends drinking. The friends question will help you identify patients at earlier stages of alcohol involvement and target advice to include the important risk of friends drinking. Scan the QR code for link to the tools and toolkits.
The GAIN SS screening tool, Global Appraisal of Individual Needs Short Screener, developed by Chestnut Health, is an evidence-based 16-question survey that takes about 3 to 5 minutes that identifies needs for further assessment in the areas of mental health, substance use, and anger management for adolescents and adults. It may be administered in interview form or self-administered. Licensing costs $100 per agency and covers 5 years of unlimited use of paper assessments only. Scan the QR code to access the GAIN SS screening tool in English. Scan the QR code to access the GAIN SS screening tool in Spanish.
Each of the screening tools has similar scoring. With the CRAFT being the most popular adolescent screening tool, we'll focus on the scores, risk levels, and recommended actions associated with it.
If the patient scores a 0 and is at the no risk level, provide positive reinforcement. So an example of positive reinforcement would be, I'm glad to see that you haven't used any substances in the last year. I recommend to all teens not to use because a number of negative things are more likely to happen when they do. However, I want you to know that you can always ask me any questions you may have about them. If the patient scores a 1 or 2 and is at the low risk level, provide brief advice. An example of brief advice would be, I recommend stopping smoking marijuana altogether because heavy marijuana use can affect your concentration. Over time, it can impact your mood and affect your performance on the football field. You are such a good athlete. I would hate to see anything get in the way of your future.
If the patient scores 3 or 4 and is at a moderate risk level, offer brief intervention. Brief intervention raises the patient's awareness of risks, elicits internal motivation for change, and helps to set behavior change goals. Brief intervention is a behavioral change strategy that is short in duration and that is aimed at helping a person reduce or stop a problematic behavior. Brief interventions usually include feedback about the screening score generated from administering a validated and standardized screening tool, such as the CRAFT, the S2BI, or other tools as we discussed earlier. Brief interventions also typically include discussions of these issues: how the youth's level of use compares to the national averages or to teenagers of the same gender or age groups, concerns about the potential effects of substance use during adolescence or young adulthood, the pros and cons of use, negotiating goals, including a commitment to cut back or stop use, and a commitment to action. A brief intervention can take as little as 5 minutes or stretch to several full-length sessions. Use your best judgment to determine how to best integrate a brief intervention into your clinical encounters.
Before you go, do you mind if I take a look at the questionnaire you filled out before the visit?
Okay.
Thanks. I want you to know that whenever patients and I talk about alcohol and drugs, my role is to share information and learn from what they want to do, if anything. Does that make sense?
Yeah.
Great. So you wrote here that you've used alcohol in the last year on at least 8 days.
Yeah, somewhere around 8 days. I'm not sure.
Okay. How would you describe your drinking?
I really only drink at parties. I don't drink at home or anything.
Okay. What kind of alcohol do you drink at parties?
Liquor, whatever people are mixing. Vodka, sometimes beer, but I don't like beer very much. The drinks at parties are usually like vodka and orange juice or gin and tonics.
How much do you think you usually drink at a party?
You mean the whole time I'm there?
Yes.
Probably 4 or 5 drinks.
Okay. You checked the box here that drinking helps you feel relaxed, feel better about yourself, or fit in.
Yeah, it makes me feel relaxed.
And you also checked that sometimes you forget things when you drink.
Yeah.
What kind of things do you forget?
I forget how many drinks I've had, like when a friend asks me, or I forget whose house I'm at.
Sometimes you forget where you're at.
Right.
Here's the part where I share information. The safest level of drinking for teenagers is 0 drinks. That's because we know a number of negative things are more likely to happen when adolescents drink. We know alcohol can harm how the brain develops as an adolescent, and teens who drink are more likely to hurt themselves by accident. Sexual assault is another thing more likely to happen, and so are sexually transmitted diseases. I'm curious, do you think your drinking has anything to do with the possibility of having an STD?
Yeah, I was drinking the last time I had sex. The guy had been drinking too, and we didn't use a condom.
Do you remember giving consent when you had sex?
Yeah, we've had sex before, and we've used a condom before.
How do you think drinking alcohol affected using a condom this time?
Well, we just didn't stop to put one on. We weren't thinking that way.
Sounds like drinking changes how you think in those moments.
Yeah, I would have definitely told him to put on a condom if I was sober.
There's something else I wanted to share. When people forget where they are or how many drinks they've had, that's a sign of heavy drinking. And when people keep drinking despite experiencing negative consequences, that can be a sign of what we call alcohol use disorder.
Well, that's not me. I don't need help from anyone.
Motivational interviewing is a communication method that is focused on the adolescent or young adult's concerns and perspectives and works to enhance their internal desire, willingness, and ability to change by exploring and resolving coexisting and opposing feelings about changing. Motivational interviewing is based upon 4 general principles: express empathy, develop discrepancy, roll with resistance, and support self-efficacy.
I'm curious. What do you like about drinking alcohol?
Well, it's fun. I like drinking when my friends are drinking too. I laugh more. It's just fun.
Okay. And what about your drinking do you not like?
I don't like forgetting where I'm at sometimes.
Anything else?
I really don't want any STDs.
Right. So on one hand, you like the feeling of being relaxed and having fun when you're drinking. And on the other hand, you don't like forgetting where you are or forgetting how many drinks you've had. And you don't like putting yourself at risk for STDs.
Yeah.
So when you think about what you like and not like about your drinking, where do you want to go from here? What would you like to change about your drinking?
Well, I definitely don't want to drink too much again.
How ready are you to not drink too much? If I asked you to pick a number on a scale of 0 to 10, and 10 being totally ready, what number would you pick?
A 9?
Very ready to stop drinking too much. Why do you think you picked such a high number like 9 rather than a lower number like a 6 or a 7?
Well, I really don't want any STDs, and I don't like wondering whether I have one or not.
Okay. What plan could you come up with to make sure you achieve that goal?
Well, I want to count my drinks so I don't have more than 2. And I want to stop drinking once I start feeling drunk.
Great. Who could help you reach this goal?
Well, I have this friend who thinks I drink too much. She would probably be willing to make me promise not to have more than 2 drinks at a party.
Okay. And how about unprotected sex? It sounds like you don't want to experience that again.
I'm going to talk with him, and I'm going to make him promise that we always use a condom and that we don't have sex drunk.
All right. So you're very motivated to change your drinking, and you have a plan to keep from drinking more than 2 drinks at parties and keep from having unprotected sex. I would like to hear how it's working for you. What do you think about coming back in 6 weeks or so?
Okay.
Great. Thanks for talking with me, and I look forward to seeing you again soon.
A few key points to remember. Motivation to change is elicited from the patient and is not imposed from outside forces. It is the patient's task, not the practitioner, to articulate and resolve his or her ambivalence. Direct persuasion is not an effective method for resolving ambivalence. The counseling style is generally quiet and elicits information from the client. The practitioner is directive in that they help the patient to examine and resolve ambivalence. Readiness to change is not a trait of the patient, but a fluctuating result of interpersonal interaction. The therapeutic relationship resembles a partnership or companionship.
If the patient scores 5 or 6 and is at the high-risk level, offer brief intervention or referral to treatment. Referral to treatment provides those identified as needing more extensive treatment with access to specialty care. Congratulations, you have completed the SBIRT training video. For more information and to access the tools mentioned today, please visit our website at njprevent.com/SBIRT. In order to receive 1 CEU credit, please take the following survey. In order to access the survey, scan the QR code. Thank you and have a great day.